Hey there, I'm Dr. Hurst Peacock with Medical Center Plus. I hope you're having a great day. I'm actually sitting here in one of our Medical Center Plus treatment/exam rooms, and I want to talk to you about something that comes up a lot with people when they start to consider using chiropractic as a tool to help them heal and feel better. If you have ever heard somebody say, hey, don't go to a chiropractor because if you go to the chiropractor, then you'll have to go for the rest of your life. That's a very common thing that people say. So I want to talk to you about that because there is some truth to that, but it also doesn't have to be that way. So let's talk about it. First of all, let's talk about the statement itself. Is it even true? Well, there's nothing that happens when you receive chiropractic care that then makes you dependent on having to have that care for the rest of your life. So if that's what the person means, then they're misinformed. That doesn't happen. But is it true that a lot of chiropractors will recommend that people stay on maintenance care sort of indefinitely? You know, come in twice a month, maybe once a month, every 3 weeks, something like that, in order to keep their spines in good shape. Is that true? That part is true, yes. So then the next question we have to answer is that a legitimate care recommendation? And I'm going to give you a really solid and definitive maybe. Maybe. It depends. It depends on what the circumstances are. So let's do this. Let's first of all establish a ground rule here that what we're going to talk about is the average patient or the majority of patients, because there can obviously there's always exceptions and there's always extreme situations on either end of the spectrum. So we're not going to talk about those right now. Let's talk about the average person. Is it a legitimate care recommendation to stay under care indefinitely for the average person? It can be. Under what circumstances? Well, if the only tool that's being used is chiropractic, then that usually is a good recommendation. I have been associated with programs that made those types of recommendations for most of my career, actually, until we integrated at Medical Center Plus, and we have different types of doctors here and we have more tools to use. Until that happened, that was kind of the recommendation that we had always, gone forth with as well. And it's legitimate, and I'll tell you why. Because you have to understand what chiropractic actually does and even more importantly, what it doesn't do. What chiropractic does is it identifies joints that have not been moving. Either they haven't been moving through a full range of motion or they haven't been moving through the correct range of motion. And when that happens to a joint, the joint will become sick. It'll actually get sick. Because moving to a joint is kind of like breathing for you and I. It pushes the waste products out and it draws in nutrient-rich blood and it keeps all of the tissues healthy and regenerated. So if that's not happening, then you will end up with pathological joints, you'll end up with disc degeneration, you'll end up with all kinds of problems. So will chiropractic over and over and over and over and over again, will it keep that from happening? Yeah, it will. It'll identify those joints, it'll get them moving again, then they'll exchange fluid, and then it sort of keeps that process at bay. But is there a way to do it that maybe doesn't require all of that chiropractic? And the answer is yes. See, the thing that chiropractic doesn't do, it doesn't actually, you know how people say, oh, when they adjust me at the chiropractor, they're aligning my spine. Well, almost never is that actually happening. Now, there are some exceptions, in the upper cervical area where that can take place, but usually that's not what's happening. Usually what's happening is the chiropractor is just finding a joint that's not moving and getting it moving again. Is that of great benefit? Yeah, because of the reasons that we just talked about. But is it going to actually change your biomechanics? Not by itself, it's not. So let's talk about that average patient that we talked about a few minutes ago that we said we were going to stick to. The average patient, by the time we see them, they've already been compensating for a problem for a long time. Now let's talk about the concept of compensating. If you've ever, sprained your ankle or hurt your foot or something like that, and you're kind of limping around, If you did that long enough, then you probably started to experience some pain somewhere else because you weren't walking normally. So when you're kind of, limping, you do that long enough and all of a sudden now I'm starting to get a pain in my hip or a pain in my knee or a pain in my other foot, right? That's what compensation is. So the average person doesn't come see us when they have an injury. The average person allows that injury to cause their body to compensate usually for a long time. We're talking about months or maybe even years, that they are able to successfully compensate without causing any pain anywhere else. And then, they get older or maybe they start to do something and there's more physical demands on them or something and they can't compensate anymore and the pain returns, and that's when they come see us. So they're already in a state of compensation. That means their body's gotten used to doing something that it's not supposed to really do. And that may mean their head's too far forward, or it may mean, their pelvis is twisted or it's tilted, or, there's something like that going on. Well, chiropractic will not fix those things by itself. It's not going to take a twisted pelvis and straighten it out again because it doesn't really align the spine, not like people think. It's not going to get a head that's too far forward and get it back over somebody's shoulders again. It will, to some degree, help a joint that is in a state of degeneration sort of heal up. It will do that. But if it's too far degenerated, there's a limit to how much it can help. So the question is there a different way to do this so that you don't have to continue to go to the chiropractor for the rest of your life? And the answer is yes. When we combine tools, when we look at a patient, an average patient maybe, and we say, hey, look, their pelvis is twisted, so we've got to apply some physical therapy exercises to straighten that back out. Hey, that person's head's too far forward, so we need to do some traction and we need to do some, use some physical therapy modalities to get that head back over the shoulders. Hey, we've got kind of severe degeneration down there at L5. We need to do something to help that patient out with that. So let's prescribe some orthopedic bracing, something that they can use for stability if they're going to be doing something strenuous at home, or just for support that they wear for a certain amount of time per day to help that area have a chance to heal up. Or hey, listen, we could even apply regenerative medicine. We could do a hyaluronic acid injection there. We could do some PRP, or we could do something, to really help those joints heal up. When we start to combine those things, not only are we able to help people get better faster, but then they don't have to sort of continue to come just to keep the wolves at bay. Because we've done so much with them in terms of actually being able to heal the problem, solve the problem, correct the problem, correct those biomechanics that cause the irritation in the first place. And what we find is that we're able to, with a protocol like that, we're able to help people much faster, and the results are much more longer lasting. So hey, listen, I'm glad you clicked on the link. I'm looking forward to meeting you in person, and I hope you have a great rest of your day.